Hello, my name's Ian McCall. I'm a Fellow of the Australasian College of Dermatologists and the Director of the Australian Institute of Dermatology. Today I'm going to chat to you a little bit about store and forward teledermatology using the website skinconsult.com.au teledermatology. Store and forward dermatology is different from video conferencing. In store and forward, you simply put a patient's history up along with some images and send it to me. I then send you back my consultant's opinion and you then act on it. Let's show you how this particular website works. First of all, you have to phone me at my practice number here and give me your phone number and details. I'll then phone you back and organize a username and password for you to access the Skin Consult teledermatology site. So let's go in. You put your username and password in here, press submit, and in you go. Now you'll see here it tells you when the next available appointment is. I've said that I can't diagnose pigmented lesions accurately over the internet. Well, not unless you provide me with very good dermatoscopic images as well. But how are you going to supply the information? You can either submit it in this online form here, or you can submit a patient's history file. Let's look at the online form first. The submitting doctor's details are always at the top here. You then put in the patient's name, sex, date of birth, phone number, Medicare number. Then I want to know, where did the rash begin? That's always important to me, and the symptoms the patient had and how the rash has progressed, how it's spread since the initial episode. I want to know how long they've had it for. I need to know what treatments have been given for the rash, and especially the treatments used in the last week, because often treatments will change the surface morphology of a rash, especially topical steroids. I need to know about their drug therapy, because drug reactions are very, very common as cause of skin rashes. I need to know their allergies, previous skin diseases. It's not uncommon for someone to have atopic eczema as a child and then to present with a hand dermatitis when they're older. Past medical history, I need to know what other conditions they have. Many disorders have skin manifestations. Lastly, this little bit here, does the patient have asthma or hay fever? Knowing whether the patient's atopic I find very helpful in analyzing skin rashes. Patient has to consent to the information being sent. And when you've filled that in, you basically go down here and choose your images. You basically click choose file, and it'll take you to wherever you keep your images in your computer and your patient's file. Select the images and attach them. We used to have a restriction on image sizes. We don't now, but I really don't need images any bigger than 500 kilobytes. Very often, unfortunately, cameras now take them at 3 to 5 megabytes, which is far too large, and we really don't need them that big. If you have trouble resizing images, I'll put up a webinar here, a video for you that will explain how to do that. Okay, so once you've done that, put your images up, you just press submit, and the file's automatically sent to me. What's the other way you can in fact submit a case? Well, you can submit a patient's history file. You would click this area up here, and all you have to do here now is put in the patient's Medicare number. There will be a little box added soon just for the patient's phone number, and click here to choose the patient's history file. Now you can take that out of Medical Director or anywhere else you want, or you may have produced a Word file with the patient's history, and you can simply attach that and send it to me. Again, you attach your images, again put in consent, press submit, and it comes to me. That's all you have to do. There's no great skills required to be able to submit material. The important thing is that you've in fact taken good photographs. And let's look at photographs. What do I need? I need an overview, a distance view. Then if you're going up close, make sure you put the macro on so that your close-ups are then going to be in focus. I need a reasonably close-up image of the rash. 3 images really are enough. I don't need any more than that. You'll find within the website that there's a variety of other little things you can access. There's a thing on informative cases where we have a variety of rashes and disorders at the side here, and you can simply click on one of them to access it and have a little look at the particular images that that are in fact there. They'll all expand to allow you to get a closer look at them. This website was actually set up, must be almost 8-9 years ago now, when I had been hoping that there would be a telemedicine item number then, and it's taken all that length of time before we're eventually going to have it now, with the Australian government introducing it in July next year. So there's some aspects of this that may seem slightly dated, but we'll be altering that. There's a section also on treatment guidelines. You'll note in here the major conditions themselves. You simply click on those to go to the section where I've given my simple treatment guidelines and the medications that I would use. I may just direct you to this once I've made a particular diagnosis to save me going through the various aspects of treatment in the letter, but I'll probably add some material as well as direct you to this. So that essentially is how you submit a case. The case comes into me in the admin side of the website. I access it and then I write back to you. You'll get the case sent back to you as a PDF file, which you then are able to store in your patient's records. Generally, I see I can vary the number of cases I see each day, but if, say, 3 cases have been booked, I'm only seeing 3 a day, then the next appointment time you'll get will be the next day. And I guarantee that you'll get a response within the time that's stated. So if you're interested in storing forward teledermatology, then I'm quite happy if you'd like to register for this particular site, get a feel for it, and then you'll be well prepared for the onset of the teledermatology item numbers in July. Because these item numbers, there'll be an item number for the consultant who's doing the report, and there'll also be an item number for the general practitioner for the work that he has to do in preparing and submitting the case in the first place. I hope this has been of some interest. I look forward to chatting to you. If you phone this particular number, I can register you for the website. Thank you very much.